Welcome to this live session. We have Dennis Sundvik here with us today. Dennis is an assistant professor at Hanken School of Economics, one of the oldest business schools in the Nordic countries. Today, he's going to talk about his research together with Jesper Haga and Fredrik Huhtamäki on workplace injuries and illnesses. The topic of this talk is ruthless exploiters or ethical guardians of the workforce, powerful CEOs and their impact on workplace safety and health. If you have questions during the presentation, please write them in the chat. We will have a Q&A after the presentation. Dennis, the floor is yours.
Thank you. The issue of workplace safety and health is an important one. We could, for instance, look at the costs. In the European Union, the economic cost of these workplace accidents is estimated to be around 3.3% of total GDP in the Union. So that's a number that's equivalent to the GDP of a country like Sweden. In the United States, workplace injuries and illnesses annually cost the society around $250 billion. That's more than the total amount spent on all forms of cancer treatment. So based on this motivation, we have conducted a study where we highlight the role of CEOs as a mitigating factor of workplace injuries and illnesses. We have specifically studied whether structurally powerful CEOs, CEOs also serving as a chairperson, affect these injuries. What we find is that companies governed by such powerful CEOs have fewer injuries than other firms. This stands somewhat in contrast to the current media picture of powerful CEOs like Elon Musk and Jeff Bezos. These guys are usually portrayed as ruthless exploiters of the workforce, mostly due to their company's poor safety and health records. On the other hand, we also have powerful CEOs that are more seen like ethical guardians of the workforce. One such example is the late Paul O'Neill. He was the CEO of a big industrial company in the US called Alcoa, and his target was zero injuries. And one of his famous quotes is that if you want to know how Alcoa is doing, you need to look at our safety figures. So we take anecdotes like this, and our reasoning in our paper is that companies with so-called structurally powerful CEOs have a different CEO and board dynamic than other firms. So there could be less pressure coming from the board, for instance. This leads to a situation where we have powerful CEOs that may obtain private benefits at the expense of the owners. So there will be a larger focus on non-ownership stakeholders in such companies. And this private benefit that I'm talking about, that the CEO can obtain, can come in the form of better employee and union relations, but also as protection against corporate raiders in a takeover situation. So the data set that we have been working on in this paper partly comes from the Occupational Safety and Health Administration in the US. So we look at US companies, and we specifically look at establishment level data here. So we have information about a firm, but also about its factories. So a firm could have multiple factories, and for these factories, we know the number of employees, the the number of injuries and illnesses, the number of hours worked, and so on. We connect this detailed information with company financial statement data and stock price data, but we're also, of course, interested in the chief executive officer. And we code these officers as either being powerful or not, less powerful or more powerful. Our main findings is that companies governed by a CEO that is also serving as a chairperson, so this would be a structurally powerful CEO, they have 1.75 fewer injuries and illnesses on a yearly level per 100 employees. We find similar results with similar measures of CEO power. However, we find a reversed relationship for so-called founder CEOs. When we look at establishments further away from the corporate headquarters, we see that establishments further away have more workplace injuries and illnesses than those closer to the corporate headquarters. In cases when there is a structurally powerful CEO, we find that such CEOs mitigate this difference in the number of injuries and illnesses. Our results are quite robust because we document that they are not driven by blockholders, CEO compensation contracts, nor the quality of corporate governance. So the key takeaway that we want to communicate is that powerful CEOs seems to be better positioned to foster safe workplaces. And where prior research and prior studies have mostly highlighted the dark side of powerful leaders by, for instance, documenting that they pressure the workforce more in order to reach earnings targets, there we come in and inform practice of the bright side of power. Thank you.
Dennis, thank you for the presentation on this very important topic. We have received a handful of questions from the audience. So let's start with the first question. Dennis, could you shed some more light on the difference in your results for structurally powerful CEOs and founder CEOs?
Yeah, so thanks for the question. We find fewer injuries and illnesses with a structurally powerful CEO at the top, and we find more injuries and illnesses with so-called founder CEOs. We reason that this difference comes from the fact that founder CEOs usually hold a large stake in the company that they govern, and this means that their interests will be more aligned with the interests of other shareholders. The fact that we see that structurally powerful CEOs cater more to non-owners, in this case the employees, is then consistent with that story.
Thank you for that answer, Dennis. We have another question for you. Do you have any examples of when CEO power has allowed the CEO to focus on workplace safety and health?
Here, I think the prime example would be the late Paul O'Neill, which I also highlighted in the presentation. So he came in the late 80s to this Alcoa company as a powerful CEO. And he basically told the board, told the shareholders that I want to focus on safety over profits. This was something that wasn't really liked by the shareholders nor the board. Some people even said that, hey, what is this? Did we put a hippie in charge. This would, of course, be different in today's corporate world, but in any case, Paul O'Neill remained at his office for more than a decade after this, even though there was strong resistance to these new policies. So I think it took a powerful CEO to remain in that office.
Thank you. The results of your article suggest that powerful CEOs are good for workplace safety and health. But according to your research, what is the net effect of having a powerful CEO for the owners of the company?
So that could be a limitation that you identify with our study here, because we don't really dig that much into these net effects. Of course, we could have a situation where the powerful CEO also obtains other private benefits than these better employee relations. We could also have a situation where maybe the lower level of injuries that we see in this paper is like lower than what is optimal. And then there could be a longer discussion about net effects. But maybe that is something for future research.
Thank you for the answer. We actually also have a follow-up question. What is the net effect of having a powerful CEO for the society?
Thanks for the follow-up question. I think for society in large, then it is more like, okay, fewer injuries and illnesses leads to less suffering, less pain, lower wage losses for individuals, for firms on a greater level. We have also less negative media attention, lower insurance premiums. So I think everybody benefits, and for society at large, I think it's a good thing with lower amount of workplace injuries and illnesses. But regarding the pinpointed net effects, that's a limitation of what we do.
Thank you for those great answers. We have more questions for you. There is an ongoing debate concerning the role of for-profit corporations in our society. Some debaters call for more socially responsible public corporations. Based on your results, do you believe that powerful CEOs could speed up this process?
Well, thanks for the question. There was quite recently a roundtable discussion with many prominent CEOs around the table, and a conclusion was that these CEOs, they want to focus on CSR. And I think based on our study, it seems like powerful leaders are in a better position to actually make it happen. Because what we see here, workplace injuries and illnesses, could be considered as some kind of a real CSR effect.
Thank you for that answer. We have a final question for you. Some people may find your results somewhat surprising. Are there any other similar results in this field of research? Results connecting CEO power and employee well-being?
Yes, there is actually one paper that we also cite in our study, and that's the one by Cronquist et al. It's published in the Journal of Finance, and it focuses on influential CEOs as well. And they find that these powerful, influential CEOs pay their workers more. So once again, this is like a study that is consistent with our result that these powerful CEOs obtain a private benefit from catering to these non-owner stakeholders. So in that case, it could be increased loyalty.
Thank you. That question concludes our Q&A. I believe that all of us was more than satisfied with your informative answers.
Thank you very much.
Dennis, thank you for the presentation and the Q&A. If you felt that you missed something during the presentation, don't be sad. An online recording will be available after this session. And if you want to know more about this article, you can read it in the Journal of Business Ethics.
Yes, that's correct. And this one is open access as well, so it's free to read for everybody.